welcome, welcome. We are now live. It is Friday, June 12th, and we've got an amazing presentation for all of you, our viewers, our callers. We thank you so much for spending your Friday, June 12th with us. Just bear with us as I am going to get started very shortly here, but we're going to give the next 30 seconds to a minute to just let everybody get on, to be settled. You know, if you're on your lunch break, awesome. Sit back, relax, enjoy the show because we've got a great event webinar, and we see our lovely Kimberly Lloyd, our executive research and scientist here in the house in live, our webinar, as well as Dr. Samina Ahmad. So I just want to make sure that we're just letting everybody just give them some time. 30 seconds, the next 30 seconds, get settled. Grab your notebook, grab your phone, grab your whatever you need to take notes, take some pictures, tell us why you love being a part of LifePharm. It doesn't matter. We want you to know we're so grateful for all of you to join us. You can be doing anything else, but you chose to spend your Friday, whether it's morning time for those who are in Australia, in Malaysia, or if it's noon here in California. We're so grateful for all of you. I am going to let you know that all of you are seeing live where we're going to be presenting this monthly. It's a special one. It's just amazing because we've got our two presenters that have worked really hard to share with you their knowledge. And so I'm going to get started in just a minute, but I want to be able to honor everyone here and let you know we really want you to be able to hear us. So first, can you hear us? And secondly, can you see us? Can you see our slides? Can you see our lovely faces, meaning Kimberly and Dr. Samina? I'm hidden behind the background because I want you to be able to focus on our two presenters most importantly. So with that, I will go ahead because we are ready to get started. It is time. I just want to say thank you so very much to all of you who are joining us. My name is Martha Whitfield. I am the Senior Sales and Customer Support Manager. I'm so proud to be a part of LifePharm. My role here is to support our IBOs in North America. So if we're from North America, put in the chat room, you are from the US or you are from Canada. We want to give you shout outs. Thank you so much. As well as, let's not forget our Trinidad and Tobago, our Jamaicas, our Caribbeans, our territories, our Hispanic market. We are grateful for all of you. And as well, I want to honor all those who are joining us early over there in Oceania, across the oceans, over 3,000 miles away from us, Australia, New Zealand. We are grateful for all of you. And more than anything else, I want you to know that this is just an exciting time that we are living in. And so I woke up this morning and I'm just want to always honor that life that I have and just to be full of gratitude. So we're going to go quickly to just the agenda. I've already welcomed many of you. If you're new to our live webinars, please put new in our chat room. Tell us who you are. Where are you Zooming us from? Where are you calling us from? Please, this is your opportunity to get to know us and get to know our products and our scientific advisory board member, as well as our executive research and development scientist, Kimberly Lloyd. So we're going to go over this just quickly. We're going to go and spend at least 30 to 40 minutes minimum. So if you've got the hour, please spend it with us. We want you to know at any time if you do not have time to finish our live questions and answers, it's okay. We have this recorded. However, we love the energy when we get it live. So what I'm going to be asking you right now as you're preparing to listen, to learn, and to receive everything that you are going to just need to be able to have the most amazing health, and of course to just be taught. We want you to prepare your questions and ask it in the Q&A on the chat room. There is a Q&A in the webinar. If you don't know how to do that, it's okay. Just let me know and I will walk you through all this. We know many of you may be challenged because you're listening to it by phone, or you're at a desktop, or maybe you're somewhere where you're not able to, really speak to us, and that's okay. There is a Q&A section on the webinar that you can go into and ask your questions. And when we get to the live questions and answers, what's beautiful is that you get the opportunity to hear from these two amazing leaders and honestly, like experts in their field. So with that said, I want to also remind everyone, as we are learning together, as we are growing together, as we are expanding our mind and really receiving all that we have to learn, to be better people, to be better human beings, and to get the most amazing health. Anything that you're hearing today on every of our webinars, we want to tell you we are here to be compliant. So full disclaimer, these statements that you're hearing have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or mitigate any disease. So we want you to know that even here on a corporate side, we are always so very cognizant of what we do, because right now we are always going to be looked at as, are you really legitimate? So with that, I want you to know that I have the honor to introduce you to Kimberly Purdy Lloyd. She has such passion and drive to educate our consumers, as well as our IBOs, and as well as our corporate team, about the safety, the efficacy, the benefits and functions of various nutrition ingredients. And she focuses and specialty in wound care and cosmetic formulations. With more than 20 years in the field of developing clinical and basic research and publications, she holds a pre-med degree from University of Texas at Arlington and a master's science degree in biochemistry from University of North Texas. Her thesis was published in the Archives of Biochemistry and Biophysics. So I have the honor of at least bringing her here so that she can introduce herself even more and just let you hear her passion and her drive and her commitment to excellence and education. So Kimberly, without further ado, you're on.
Oh, it's so good to be with you, Martha and Dr. Samina Ahmad today, and all the LifePharm IBOs and customers throughout the world. We're so glad you're tuning in for this special webinar that Martha has worked hard to prepare. And so I will now go on and introduce our scientific advisory member. That's Dr. Samina Ahmad, and her credentials are on the next slide. Let me just highlight a few of those, if you will. The next slide. She has a medical doctorate degree from Pakistan and practiced medicine at a women's and children's clinic for years. And then she moved to the United States 15 or more years ago. She'll give you the specifics. And then she continued her education in holistic health. She has done excellent work on getting certified with the Deepak Chopra organization. She's become an Ayurvedic lifestyle consultant and practitioner, and a consultant in food and nutrition and all the herbology and herbs that are used in the cooking. She's had a cooking television show for years where she's broadcast throughout parts of Asia. And she also manages and enjoys professional music. Her husband is the main star in the Junon band, which is an internationally known and recognized band that sings beautiful music. And she supports a group in Pakistan that were flooded and had problems with an earthquake. So she also is very involved in nonprofit work. She's just an outstanding lady. And I have had the pleasure to know her for about 2 years and bring her on now and let her talk to us today. She'll talk about a few topics, and I'm going to turn it over to her now until a little bit later. Thank you all so much.
Hi, everyone. I'm Dr. Samina Ahmed. Thank you so much, Kimberly Lloyd, for your wonderful introduction. You are my soul sister, someone I always go to for guidance, because I have to tell you, science is very important to give credentials to almost anything that we, want to certify. So thank you so much for, briefing everyone on what I do. And thank you, Martha, for all your support to make this webinar happen right now. And hi, everyone who's joined us right now from all over the world. I am so excited to welcome you to this amazing space, a platform that was, given to me by LifePharm, who came into my life about 3-4 years ago, a company run by credible people who really believe in health, healing, and wellness. So it's a pleasure. So I began my journey in Pakistan as a medical doctor and trained in internal medicine, gastroenterology for many years, then moved on to practicing pediatrics, ran my own wellness clinic, a family clinic in Pakistan, and also did television teaching people how to stay healthy. About 20 years ago, I came to the US. And I have always had a keen interest in holistic medicine. My intention initially was to practice allopathic medicine, but somehow circumstances brought me to this wonderful field. And I was able to learn from masters and gurus like Deepak Chopra, Dr. Jain, Dr. Shekhar Anambotla, and literally traveled to exotic places like India also to learn detox and train there. Now, this field that I really specialized in, Ayurvedic medicine, is like 5,000 years old. And it actually taught me that I'm not only a physical body, which according to the science I had learned, I was always thinking of, but I'm also mind, body, and spirit made up of many layers like an onion. So I got fascinated and delved deeper and deeper. And then literally in the last 20 years, I think I have like more than 18 certifications. And my kids keep telling me, it's like, Mom, when are you going to stop studying? And I tell them, guys, I think I'm going to do it till my last breath. And I'm learning every day. I'm sure like many people who are on this webinar right now, we learn from kids, we learn from our experiences every day, but it's all good. And I was able to, even study with Dr. Andrew Weil, who's the father of integrative medicine. And with over 38 years of being in health and wellness, all I can kind of share with you today before we start the webinar is that my dream and vision is to see a field which would incorporate preventive medicine, protective medicine, preemptive medicine, and personalized medicine, and incorporate it under the umbrella of integrative medicine, because that's what I practice. So I'll give you an analogy. I'm like a construction worker who has a belt with a number of tools, and I pick up the tool that I feel is important for my patient or client. And I don't restrict myself. I do not put down any science, because what I've learned is that each and every science gives us a lot, and it's like a big puzzle, and these are different pieces of that same puzzle, and we need them time and time again. So I would urge you all as well to, you've come to attend this webinar today, attend it with an open mind, and your energy today will guide me in my presentation and will take it in the direction that we want it to, right? And my personal intention before I begin the webinar is that by the time you leave me today, and Kimberly, my beautiful friend, and Martha, you would have gained an insight into how you can achieve wellness and wholeness in your life by basically listening to your own body signals, something that was gifted to you by nature. So just use it. That's all I'd like to say. So let's start our webinar. And the presentation today actually is going to involve a lot about, immunity, what it is, how you can increase it, it gets decreased, how to actually discover when you have a very weak immune system, but it'll also be in a storytelling style. So I'm going to bring up some stories about my personal experiences using LifePharm products, as well as a medical doctor and an integrative practitioner, how things have actually become more clearer for me. I have to tell you, I was talking to Martha earlier on and I said, I don't know if 1 hour is enough for this topic or the presentation, because there's so much to share. And I personally feel I have a tendency to get overboard and get carried away sometimes, because I want to tell you all I have learned, because I believe in that saying, that it's actually, the actual saying is, the love in your heart wasn't put there to stay. Love isn't love till you give it away. So I have, in a way, changed it a bit. For me, the knowledge in your mind wasn't put there to stay. Knowledge is not knowledge till you actually give it away or share it. So my aim always is to tell you more than the time actually allows. So please forgive me and excuse me if I do that today. Well, that's what the presentation is all about. And we will start with our first slide, which is about immunity. So the basic understanding of immunity comes from learning about one word which has followed me in my life, and that word is balance. So let's absorb that word balance. Meditate on that word balance. And I just want you to think of that word balance only before we actually venture more into what is immunity, we are going to do a breathing exercise. It's called the 4-7-8 breath. And I want you to just relax right now, sit in the most peaceful position that you can find at this stage. Take a deep breath in and out a couple of times. You can have a sip of hot water if you want it before we start this presentation, but I want you to do the 4-7-8 breath, and also remember to do it every day, at least 2 to 3 times, because it does help you in improving your immunity. So it starts off with us inhaling to the count of 1, 2, 3, 4, holding our breath to the count of 7. 1, 2, 3, 4, 5, 6, and 7. And then letting go of that breath to the count of 8. 1, 2, 3, 4, 5, 6, 7, and 8. We will do it together, but I want you to do it with ease and with the intention of actually using this beautiful gym that God has given you called our lungs. So we are going to start this breath, and we will do 1 count of it, but when you actually do it, I want you to do at least 6 to 7 times, 3 times a day if you have the time, because I have to tell you, the benefit is enormous and the cost is none at all. So let's start the breathing exercise by starting it. I'm not going to speak, but I will be using my fingers to tell you where I'm at, and you just follow me. So I started my breathing with my nose, the inhale, but as you saw, I breathed out with my mouth. And so the exhale is powerful, and it's from the mouth, and it's like a whoosh sound. Whoosh. Now, the important thing here is to make sure that the breath, when you take it out, is done for a longer count, because the purpose is in expiration to empty the lungs. And you know the phenomena of physics, when you empty something, it fills up with air, but it amounts to the amount of space the inhale finds. The more we empty, the more air has an ability to enter. So always do a deep expiration or take out the air completely, because the filling up of air is always passive. You never have to make any effort in doing so. So let's just do one more with that in mind. All right. So let's start with an inhale. Stop, hold it. Let go. Slowly. Okay, you can relax now. All right, so you relax and breathe normally. So try to do this breath more often every day. It's very, very good for our immune system. So, what is immunity? Immunity, like I started the talk with, think of the word balance. So, when your body is in balance, which means all your organs, which are already connected, are actually healthy, and they are able to prevent you from getting any infection or disease, is immunity. But not only that, you are also not going to get any allergies or autoimmune disorders. So, this defense system that you have been given in the form of immune system is basically what immunity is all about, but keeping that balance and preventing and protecting yourself from any kind of infection is what immunity is all about. So they are invaders all around us, right? Bacteria, viruses, parasites, fungi, they are everywhere. And not only are they outside, they also live inside us. I don't know how many people know this. I know many people on this webinar might be from a medical background, but my purpose again is also not to use too many medical terms, because I know many people are not acquainted with those kinds of terms and they would like to hear it in a simple, plain language which they can understand. The purpose of education is to make sure that I communicate to you stuff which you will be able to assimilate, absorb, and then put into practice. So, simply put, a good immune system means you have the potential to fight invaders or have a great defense system which protects you from diseases of all kinds, right? So, let's move on to the next slide. Now, there are certain factors which are going to increase your immune system or immunity. And these factors can be managed without any medication or anything that is, moving more into aggressive avenues. And what is that? The first one is good hygiene, right? So we've been talking about, COVID-19 currently, and they've been telling you wash your hands for 20 seconds under the water, but it all amounts to keeping clean. So I feel there are gazillion diseases that can be prevented if you just maintained a good hygiene, trying to keep clean mentally, physically, emotionally, and spiritually. That's what my definition of good hygiene is. Not only me as a physical entity, because I told you we are like an onion. We have many layers. My outer layer, by the way, is the environment. And that's what Ayurvedic medicine taught me, which is also called Unani medicine in Pakistan and some of the other Asian countries. Now, this particular type of science tells you that your outer layer does not start with the skin. It starts with the environment. So keeping your environment clean is conducive to having good hygiene as well. Being responsible for clean climate, everything is our responsibility. It is our outermost layer, right? And then it's your body, which depends on good nutrition. What is good nutrition? After all these years of study, that's what I want to tell you. The key things is a good nutrition set would be a Mediterranean diet, where your diet is clean, it's a whole food, it's actually in the packaging that nature created. The way nature presents itself in a food, whether it's a food or a fruit or a vegetable, eat it the way it is. Like, a lot of times you'll have an orange and you'll try to take out the white stuff around it. Guess what? That white stuff is important. It's the alkaline stuff. So if the acid in the fruit needed to be balanced, that's what's balancing it. So don't throw off that white stuff, which they've also now through research proved that it's great for the heart. So your nutrition should contain more vegetables and fruits. And if they are organic, that's even better. Then we have the most important thing which helps immunity, and I think you're all conscious of it, but unfortunately we don't practice it, and that's sleep. Oh my God, how many of us are not doing it right here? Because you need at least 7 to 8 hours of restful sleep. Because what happens during sleep is that your body gets regenerated, it gets refueled, the repair work happens, and you are able to then get up in the morning and then carry on with your life. If you have bad sleep, you will not be able to really function well. And I'm sure everybody on this webinar understands what happens when you don't sleep on time. So part of a good, healthy body is having a good sleep hygiene. And I would recommend 10:30 p.m. wherever you are. But guess what? Because of overstimulation due to these gadgets that we have in our life, you have your cell phones, you have to watch certain episodes on Netflix at a certain time, which you programmed yourself to believe. If you don't watch it, you feel your day wasn't useful. And people these days have been watching more television than they should, more internet, more social media. So try to give yourself a break. I even tell people, hey, do a news break, which means you're going to do a news fast. You will not find out what happened today in the world. It's okay, relax. So try to feature that in your life and try not to get overstimulated by the electromagnetic radiations that you get through all these things. Sleeping on time, 10:30 if not possible, and you're sleeping at 2 a.m. I don't want you to move to 10 p.m. It won't happen. I want you to be realistic. So let's try to move the clock 30 minutes back. Okay, can you do that? It would be really good, because with that 30-minute making the 2 a.m. sleep time into 1:30, slowly and gradually, we will ultimately arrive at that 10:30 p.m. perfect mark, where you will be able to also wake up early in the morning, because early to bed and early to rise is important. So exercise, we all know, incorporating at least 35 to 40 minutes of an exercise, and the best one with no side effects is a brisk walk. And even in times like right now with the COVID-19, I felt that people were going out to open areas, if it was a park, and you don't have to wear a mask if there are people not around you, because jogging with a mask means you're going to compromise your oxygen saturation. Not a good idea at all. The mask is truly important to wear, but you have to wear it whenever you feel you are going to encounter other people around you, right? Whether it's a shopping mall, a supermarket, whether it's going out and, into a post office, or wherever you have to go. The mask has been able to really help everyone protect themselves. And I have a friend who's an epidemiologist, and he told me that 50% risk of getting COVID-19 infection is available to you if you wear a mask. So please try to practice that. Maintaining a good weight, always good. And then having a spiritual center or groundedness, because remember, you are mind, body, and spirit. And this chaotic life full of so much stimulus barely gives you time to connect with your soul. So if you could just find time, 30 minutes in the morning when you wake up and 30 around sunset, that's the best time to meditate. And in my training of so many years, the one thing that I have felt has benefited me personally and has really helped me in facing life in facing anxiety and stress has been meditation. And I'll talk more about it as we move into, other aspects in this webinar. So, what are the factors that decrease immunity, right? And there it is, number one, stress. So, stress equals sickness. Please absorb that fact. Stress equals sickness. So important to understand. We all know what it is and we experience it, but we are not really doing enough to get rid of it. So, I want to also give you a little differentiation between stress and anxiety. These days, the pandemic is there, so it gets into each slide of mine because I have to talk about this. The pandemic, instead of being a COVID-19 pandemic, has started becoming a fear and anxiety pandemic all of a sudden. And I have understood the fact that we might not really realize the aftermath of this whole thing till we come out of it. But guess what? There'll be people who will face uh, diseases which are related to the mind, things like depression. And it's all based on how you are handling your current situation right now amid this pandemic. People who will handle it in a more holistic way will not go through these different elements of depression. They will stay healthy. However, people who go into the fight or flight mode or also start experiencing anxiety created by overthinking will not have a good future, I'm sorry to say. There'll be definitely trouble and turbulence. So in order to explain stress, I would like to use the word fight or flight because nature gave you a system in your body from the day you arrived in this world called the fight or flight mechanism, which was mainly, I guess, to give you an example, if you remember the time period when we were in the caves and we were basically more like a reptilian in our mindset, even our brain wasn't that evolved or developed. So if we saw a lion, our basic thing was kill it or get eaten. So either eat an animal or get eaten. And that was the fight or flight. Now, the concept was not to have stress all the time or to be in the midst of it forever. It was for a short period of time. And when that fight or flight mechanism keyed in, your heart rate increased, your breathing became more rapid, and then there was sweating, cold, clammy skin, and all the blood from the stomach went on to support your limbs and your arms so that you could run for your life, right? But what happened was that we basically got involved in doing too much in a 24-hour period and also started thinking too much. And I do understand that, the brain is overthinking all the time. It has to, it's automatic. And according to studies, 60,000 thoughts come into our mind in a 24-hour period. And guess what? They're all negative. They're all about the past, something that you regret you did. You can't change it, but you're regretting. And otherwise, it would be about the future, stuff that you are scared about, you're preempting, overthinking, the uncertainty. So now you are overwhelmed. And what's happening is this whole cycle of fight or flight is constantly in your body secreting cortisol, the stress hormone, also producing adrenaline, norepinephrine. These are hormones which are going to hurt our body if they get overly secreted. We don't want that to happen, right? So there has to be a way that you can try to tame stress. Whenever it happens, recognize it. See the symptoms in your body that are happening. It's always an external influence in whenever stress happens. It's an outer observation which your mind perceives in a bigger and larger way. To give you an example, it's like two people in a room and there is all of a sudden a beetle in the room. Now, the danger, the beetle is the same for the two people, but one person is going to freak out and the other might just say, oh, it's just a beetle. So that's the difference. Your perception is what guides your response. Please do not perceive things out of context. Don't build mountains out of molehills. You need to understand it's an issue or a problem, but try to be a solution maker. And I tell people, don't be a problem creator, be a solution maker in life. There's always a solution to things, right? We just have to find it. So the first thing is like the 4, 7, 8 breath. We see the beetle. If we are going to go into that panic mode, let's just try to relax a little, right? And then try to find out the solution. Now, anxiety, on the other hand, is coming from inside, really deeper from the core, because guess what? In anxiety, the problem is not even there, but your mind is conceiving it to be a problem. It's telling you there is something wrong, but guess what? There is nothing wrong. So that is something which causes more problems in our life. Then again, try to move, do things. Sedentary lifestyles are never good, right? So always being active, trying to exercise, important, like I said. But if you don't, that sedentary lifestyle will make you go into a state where you will start getting lifestyle diseases. What are the lifestyle diseases? They are diabetes, heart disease, obesity, cancer. All these are related to my lifestyle. And if I change my lifestyle and become a healthier human being, then those lifestyle diseases, at least I can get out of my life, right? So that's the main thing. Trying to nip it in the bud and trying to take care of yourself. So please also, through this slide, what are factors which are decreasing immunity? Try to take care of yourself. You are the most important person in your life. You must remember that. And you remember when we take those flights, they always tell you put that oxygen mask first yourself before giving it to your child or anyone else. So you need to value yourself. Because guess what? When you value yourself, you also get valued by other people in your life. Next slide. So here's an interesting slide, and I love it because of the fact that we see people from different ethnicities in it, and they're all laughing and happy. So I wanted to, put this slide on to actually describe something important that's happening right now. A lot of the younger people are thinking that in the midst of this pandemic, they will be spared and nothing can go wrong to them. But I would like to urge them to understand one thing, that with life, with time, the people who become older, like 60 plus, they are always at a risk of getting diseases, infectious diseases. And we need to respect their space too. So if you have a grandfather or a grandmother and you decide to go out to the beaches or you go out and meet your friends and you never practice wearing a mask, but you go and say hi to grandma, then what you're doing is you're risking her life. Please be mindful of what you're doing. You need to be responsible. This particular virus is not even age conscious or conscious of your gender. It's basically affecting all age groups. So also don't feel overconfident that just because you're a younger individual, you will not get anything. So my advice through this particular slide is we need to take care of our parents, our grandparents. We need to make sure that they are safe. And remember, a lot of them are suffering from diseases like cancer, cardiovascular disease, diabetes, which already, because of these multiple illnesses, puts them at risk. So take care of that. Next. Now, how do we know that there's something wrong with us, right? I always teach my clients and my patients that the most important thing is your own observation. You need to be observant. because the body is so intelligent. It tells you when something is wrong. And I usually guide them on principles of eating too, because I have, studied nutrition and everything. So I tell them, guess what? God gave us this particular system in our body, which is called the satiety center. It's right here. So we are supposed to stop eating when we are literally not full till here, but we have left at least a little space for air. So if there are three parts of you, first part is for food, the second part is for water, and then we leave that last part for air. Do not fill up that washing machine literally with gazillion clothes. They're not going to get washed, right? So that's the same thing. When you overburden yourself, you get stressed. When you overburden your digestive system, it gets weak and you are unable to digest properly. But the body has intelligent systems. Listen to your body, listen to those signs and signals. They are going to tell you when it's time to stop. So that little point you see on the slide of being tired and lethargic, how many times do we know that we need to stop because we are tired? We need to sleep. We need to tell our friend we can't see them because we can't see them. We don't have the energy. You and I are made up of energy. And energy is something like your cell phones have it, the battery, right? When the battery is gone, what happens to your cell phone? It's dead, right? So similarly, we have this energy in our body too. You either have to do things which will re-energize you, then go ahead and do what you want. But if you don't, and you constantly expend energy and do not have resources to bring it back into your life, guess what? It's going to be all over. So important to stop. Stop when you feel you're getting tired, all right? Finding time for yourself. And that's what's important. What are the signs? Well, the signs are mainly that you will notice that you start getting sick more often. And I've seen that in school children. A lot of times kids go to school and there's a class of 20 to 25 children. And how come? Some kids keep falling ill all the time. Anytime, spring comes, they're the ones coughing, they're the ones with sinus issues, they are the ones with itchiness. So these are the people who need to understand that their immune system is weak. Please, you need to then take care of that immune system and strengthen it. And what else happens? I'll tell you, the feet become cold. All of a sudden, you've been sitting watching television, and all of a sudden, you feel how come my feet feel so cold? Well, you have a sluggish circulation. And many times, diarrhea alternating with constipation, sluggish situation with your gut, because these are people who eat dinner yesterday, they had dinner. They wake up in the morning, there's no desire to eat. They haven't been able to digest the food from last night. So getting tired and lethargic, just at, doing nothing at all. I know I have clients and patients who tell me, doctor, I don't really do much, but why do I get up in the morning and I'm so tired? So that's a weak immune system. Now, on this slide, I do mention LifePharm here because their products literally have helped me in supporting my immunity, and I will tell you more details about it. But I will use a word on this slide called psychoneuroimmunology, and I want you to understand the meaning of it. It's a very long word, but let's break it up. Psycho, the mind, neuro, your nervous system, and immunology, the immune system. So think about it this way. You've got your brain and spinal cord, your nervous system, and then there's a triad, the endocrine system, all your glands, and then your immune system. So what happens is they have done research and found out that the brain is literally communicating with your immune system through the endocrine systems or your glands. So the mind has a direct effect on our endocrine or glandular system and has a direct effect on my immunity. So to give you an example, people who are very sad and are usually stoic actually you can see some lines on the face also. It's interesting how we get frown lines because more muscles are required for frowning than for laughing and smiling. I would urge them to take life as it is. Do not take it too seriously, you know, but try to lighten up. You know, it's okay if things didn't get done. If there are some unwashed dishes in the sink and you're tired, let go. We'll wash them tomorrow, all right? Let's not be OCD, let's not be type A, you know, the hurry, worry, curry person or somebody who is so meticulous and is so rigid about things. I always tell people try to be the reed which grows next to the water, and when the wind comes, it blows and sways. It's relaxed. It's okay. I have no ego. I'll bow down. I'm not going to be stoic because the oak tree, which is stoic, does not bend. And guess what? It cracks. We don't want to crack. We want to be the reed. We want to tame our ego. It's all right. If your friend has more cars than you do, she's richer than you, she's more famous than you. If your boss was mean to you, forgive. It's okay. You know, we want to always operate from a higher level of consciousness, always try to be somebody who's not reactive like the fight or flight response that I told you, but be somebody who comes from restful awareness. You know, that restful awareness response only comes to people when they meditate, where you say, it's all right, you win. You know, I don't care. It's okay. You got the job. You were, you know, better deserving of it. So literally the mindset becomes where your pain becomes my pain. Your happiness becomes my happiness. It's a unity consciousness, you know, concept of forgiving, of letting go, and not having that control switch in your hand all the time. All right, it's okay. You tie your camel, but you also allow the universe's, you know, systems to work for you and benefit you. So I was about to tell you again about the concept of the mind. Right? They have done research and said people who were positive, who thought good thoughts, actually did not get negativity in their lives. So, good thoughts bring about a good outcome. And people who remain positive are able to exercise better, you know, outcomes in their life. They are not falling ill. Why? Because I told you the mind is literally in connection with your immune system. So the mind is saying, hey, we can do it. I can beat a disease. I'm fine. Giving yourself the affirmations, my immune system is going to win this war. So the direct link of actually influencing my immune system through my mind. So important. Next slide. Infection, right? So look at this slide. Just when you thought it was safe, right? Look at the different sizes, the different types of microorganisms, viruses, bacteria, and fungi, and so many different kinds, right? As soon as you try to take or hold or do something about one particular, infection, all of a sudden a new one pops up. So we are never in control of all this that's happening, right? We've had infectious diseases in the world since a long time. We were finally able to find antibiotics which were able to at least take control of some, but there's always a new disease coming in our life. Now, what is infection? So infection actually is when the invader that I talked to you about is going to enter me in my body, right? What are the different ways it enters? Your skin is the largest organ that God gave you. It's a protective organ. It's the largest organ which absorbs everything. Even when you're brushing your teeth, anything, if you don't have the right toothpaste, even if you are gargling, if you don't have good clean water, these invaders come in. Now, there are protections from the skin. There's a certain membrane that is not going to allow toxins to go, but a lot of times, if you have weak immunity, they will invade. The mucous membranes of the nose are also something to protect you Then you have the lining of the stomach and the acid, which actually kills these germs, right? So nature has provided you with all these different tools as well, but sometimes they take the better of us and they will enter and they will take over, right? That is called infection, and it is acute, which means when you get it initially, in the first couple of days, it's acute. It can go on 7 to 10 days, but sometimes these infections can last longer and they can become chronic. So the cells are different for the acute infection and the chronic, but mostly you've heard about white blood cells, the word, that those are your defense systems, okay? The white blood cells, the leukocytes are going to protect you always. And then we have neutrophils, lymphocytes, neutrophils for the acute infection, lymphocytes for the chronic infection, and they get divided into further like T lymphocytes and L, lymphocytes. But right now, I don't want to go into the detail of that. Just tell you infection causes disease. So let's move on to the next slide. So right now, if you see a fancy looking virus right there, COVID-19, SARS-CoV-2, but once again, to reiterate, there are certain viruses in my body, certain bacteria, which are protective. We have a whole microbiome sitting in our gut. And after going through different studies, different sciences, one thing I have understood the importance of having a good gut. So healthy gut, healthy organs, the rest of the organs. Infections usually begin from the digestive system and then they move on to other organs. If you have a good gut, you already have protection. So you have to try to, take care of your digestive system. Now, these viruses, which are good, are beneficial. I get it. And it's okay, right? They're not causing any trouble. But we have an issue from the ones which enter. And how do they enter? For right now, this particular virus is entering from our nose. And the mucous membranes over here, I guess, are right now not really trying to kill it right there and then, and it's allowing it to go in for people who have shown signs of illness. Which system is being affected? The respiratory system. Now, if you look at this particular screenshot there, the diagram of the virus, viruses can either have DNA in them or RNA in them. So these are genetic materials that they're equipped with. COVID-19 SARS-CoV-2 has RNA. So what is it? It's RNA is the genetic material inside the virus. It's surrounded, okay, by a protein coat. Now what happens is this virus on its own is not dangerous to you. The problem is viruses are literally like parasites. They have no power to do anything. They can't multiply at all on their own. How do they become powerful? They need a host, okay? So guess what happens? I'm giving you my example. So if I'm the host, what happens is during my weak sort of moments when my immune system is not good, or if I'm somebody who already is 60 plus or a little lower than that too, but has heart disease, diabetes, cancer, or some other underlying disease, because of that weakened immune system, this virus finds itself inside my body, starting from the nasopharyngeal area, going down to the throat, and ultimately going and attacking the lungs. The virus also replicates by getting inside one of my normal cells. What is the aim or objective is to find my nucleus or my genetic material, go in there, use my genetic material to replicate, to make a ditto COVID-19 through my machinery. It doesn't have its own. So it's going to find my machinery and then it's going to use it and start multiplying more of its types through transcription, translation. And once it's achieved its agenda, it'll burst open my cell and move into my body and try to make way into my bloodstream and then into my lungs and then make a home there or in any other organ that it finds to be weak. So viruses and bacteria exist in the environment as it is. They don't bother you, but they become powerful at some stage because of these epidemics or pandemics, and then they become, a nuisance. Flu, as you already know, comes every year. It's seasonal, and even people who take a vaccine, they still get it, but it might be a weaker strain. So a lot of times they have strains. Some are weak, some are strong, right? But our job is to find out how we can protect ourselves, right? That is what the main purpose of this webinar is also. So if you remember, MERS, SARS came, H1N1 came, and then in 2004 you had Ebola, which was in West Africa. But we as humans, with our technology, we were able to get rid of all that, and it didn't spread the way COVID-19 has right now, becoming larger than life and a huge nuisance for all of us, taking our lives away from us, right? So let's move on to the next slide. And you see the worldwide cases, and it's astonishing. 7.2 million people have been affected globally. That's the number for the global figures. And I think yesterday we in the United States hit 2 million, which is astronomical. And I right now am in the epicenter of where it all started, New York. And was definitely affected by it, which, by this particular fact that New York was the one with the maximum cases and the maximum deaths as well. And it's unbelievable how it hit us here. And I will talk more later on in the presentation. So look at the number of deaths, 412,000 and moving and increasing. A lot of the states have lifted the social distancing and these little bans that they have on travel, and also opened up businesses a little too sooner. That's my personal opinion, but I think they are thinking what some countries in South Asia are also doing, whereby places like Pakistan, they realize that it's very difficult to practice social distancing, to tell people to stay at home, to just stay restricted and not meet each other. They couldn't do it because there are many people who rely on daily wages, and they said, hey, the option is either to die of COVID or to die of hunger. So those were the countries which have a different strategy. What they did is that they did allow people to come out, but to exercise discretion and use their own intelligence. So use the mask when you can, but the business were not entirely closed, except for a lockdown in Karachi and Lahore for a short period of time. But I have adopted a village in Sindh, which is rural areas, where I have more than 600 people who survived the floods in 2010. I built homes for them, and they communicate with me on a daily basis, and they are not exercising that social distancing, because at the end of the day, if you have one room and there are 9 people in it, you cannot possibly do that. And somebody suggested to me, hey, listen, let's give them masks and let's teach them how to make them, and then they can use rubber bands. And I told them, hey, listen, you know what, sometimes we forget, and we try to forget that the alphabets begin from A to Z. They don't begin from M, and we start from M to Z, missing out so many words between A and M. So the same way, those people don't have rubber bands. You have to be mindful about how the disease has enveloped the whole world, but we have different cultural paradigms. We have to have certain flexibility according to the region. But for between you and me and all the people on this webinar, we are people who are educated. And for us, the most important thing is to listen to the CDC, what they're saying, to listen to what your state is saying, or your country's directions. You can find them on CDC, on WHO's website. Try to constantly find out what is the new thing, because the virus is also mutating and things change. Like recently, initially they had said, hey, put a cloth on your face. Even your own scarf is good, or any piece of cloth. And now they changed it to no, the cloth has to be 3 layers, and each layer has to be of a different kind of material to make sure that that's going to be good. So please try to follow that. I do want you to follow daily advice on what's happening by only going to the right resources. Do not listen to people on social media who are just out there, sometimes non-professional people trying to tell you things which are not right. I would want you to definitely consult the right resources. So the next slide. So I have some personal stories that I wish to share with you because of the platform that LifePharm has given me today. And I remember 3, 4 years ago, my youngest son Imran, he got fever, and all of a sudden, I mean, I'm a medical doctor. Many times don't have to go to anyone, and I take care of my child myself. But what I noticed is that initially I gave him just symptomatic treatment. For the fever, let's give Panadol, Tylenol, or something like that. But after 5 days, we saw no response at all. And we were about to travel to Pakistan, which is an infectious region. So I said, let's give antibiotic. And we did the antibiotic also. We did the labs, almost intense investigations to the point of even getting him tested for Lyme's disease, but nothing happened. The fever continued. So I remember one of my friends, Galina Pana, she's a Russian friend of mine who also works closely with LifePharm, and she's the one who introduced me to Laminine, one of the products by LifePharm, which is actually, it's a fertilized, it's from the egg, the chicken egg, and it's a fertilized embryo, and they take an extract of that, which has the same, tendency as a fibrogen factor, and it basically, the fibrogen, which you also produce, you and I, when we are really tiny, it basically decreases in our lives. So they have this factor which is going to go into my body. They extracted it from the fertilized egg, and when you put it in your body, you will actually see that it moves on to guide the stem cells in my body to start healing. So if I have bleeding gums, I will notice a difference. If I have pain in my right knee, there'll be a difference. And that's what I found out later. But at that time, she said, Samina, let's give Imran Laminine. So we gave a higher dose. We were giving almost 2 in the morning, 2 in the evening for about 3 days. And guess what? The fever went. And to this date, I have no idea how it happened. All I can tell you, for me, it was a personal experience which told me that it works. And then I started testing it on myself because I've always felt in my personal practice also that I'm somebody who believes in the proof is in the pudding, and I like to check things myself or test them. If they are supplements, I will use them. So I decided to take the supplements. Now, what was my test? My test was that whenever I traveled, and I do travel a lot for my band, my events for Junoon globally, and my social work, I go on to visit countries like Bangladesh, India, Pakistan. I would land in Pakistan and start getting an itchy throat, or I would get food poisoning from just drinking water, or eating out or eating at home. So there was always that turbulence, and I love singing. So I said, oh my God, I can never sing in Pakistan because the moment I land, I start feeling like I'm going to get a cough and my voice goes. So by taking Laminine for a couple of years, I have to tell you what my situation is currently. Now I go to Pakistan and I literally spend 5 months there. And sometimes I'm also in my village, which is a rural setting. I tell you, so much of dust and so much of chaos, but I have not contracted any disease. I don't get sick there anymore. And I'm super excited to share this with you, that now I can literally travel to wherever I want, and I'm happy. And actually, people tell me, Samina, you have some good energy, and I'm not going to say I didn't have it before I started Laminine, but I think it definitely supports my health and well-being. And now I'm using it, with my in-laws, they take it, my family members, my sister in Canada, my sister in Pakistan, my brother in Dubai. My whole family is literally on it. And I manage them. It's a great approach to keeping sure or making sure that their immune system is in good shape. But I use the two together, Laminine and Immune, and I'll tell you why later. But this particular approach of also using all the tools, remember I told you, is using all holistic means, supplements, all the other stuff I learned, whether it's herbs, whether it's natural sources of food, nutrition, combining them all together, and then giving that to the patient. Next slide. So here I am with the two boxes there, right? So then I delved a little deeper and said, hey, wait a second. I take these two supplements more frequently than I take the others. So I want to see if there's any research which kind of shows me that the two work together, especially since the COVID-19, I had to take care of my husband, my nephew, and niece who all got these symptoms. So I used this protocol and I found out that all of them together actually are increasing my immune response by the immune cells, which are there in my body, which actually are the ones, and I told you the whole thing. So COVID goes into the body as an antigen, it's a virus, it gets attached to my normal cell, and now it's trying to attack it, cause trouble. But my body's defense system decides to shoot out antibodies, and the antibodies are going to come there and make an antigen antibody complex, try to destroy it through certain cells in my body so that this particular virus is not able to actually give me an illness. So the two together definitely you have a better chance of fighting infection. Next slide. So here is my favorite slide of my rescue tray. The rescue tray was given to me by my friend Marley Armand. I hope she's watching this particular webinar, and she gifted it to me, and I said I put it to good use. So I want to tell you a little background. So in March, my nephew who lives in Delaware, Moise, he's studying there, and he called me up and said he's not well. And I'm the only caretaker for my nephew here in the US. His parents live in Dubai. So he came to my house and I quarantined him. He's an asthmatic. He's about 21 years old, college student, came from living in an apartment with 2, 3 other friends who were showing similar symptoms like fever and cough. And he told me he has a little trouble, breathing as well. So I was concerned. So I brought him, quarantined him, separate room. I wore a mask. He wore a mask. I had my gloves on. We were told there's no vaccine. There was no access to a good hospital, to doctors, no access to any medical test, which would have told me that he's positive or not. And here I was, and I think everybody can relate to it. If your loved one is sick and ill, and if you feel you have some, ability as a doctor to take care of them, even if you didn't have the ability, you will go through all your resources to try to help them. And I found myself in a position where I had no external help at all. I realized I have to do it now for this child, and I'm going to do it. So I put all my knowledge and expertise to use, and I decided to make this tray. The child had, like I told you, symptoms which required immediate, attention. And I will tell you how I managed him and others, because I want to tell you first how COVID-19 has a different presentation in each patient or person that I handle. So here's Moise, like I told you, he had fever only one day, 101. He didn't have fever throughout, but he did have cough and he had difficulty breathing. Risk factor, asthma. Second person, my niece living in Brooklyn. She is a young, young girl in her late 20s, and she called me up and she said, I'm unwell and I'm in the middle of, basically Manhattan. We are talking Brooklyn, New York, and we were the epicenter. And she said she has 4 other friends in the same apartment who are all taking care of each other, but they're all showing symptoms. What was her clinical presentation? Sana actually had a COVID-19 classic presentation. She had fever, she had loss of taste, loss of smell, she had diarrhea, and she had aches and pains all over her body, literally so much of lethargy and all that, and she was coughing a lot. And then came, so I had it was a bit tricky. I had to personally go and pick her up because there was no transportation operating in New York. Literally, New York was locked down and pandemic declared. I remember going to pick her up, that child, and I got her into my car, brought her home, but I literally sprayed her suitcases, everything, took all the precautions, and brought her in a different, separate section of my house from the outside and quarantined her. Quarantined both of them for 14 days. By the time Sana was recovering, guess what? My husband got it, and my husband has asthma as well. So he is again, and also he's 57. So I felt that, he was also in that risk factor age group. Salman had a very unusual presentation. He got dizziness and he got headache and lethargy, and the pains and were there, but fever was not there. And I remember we consulted his primary physician also, and he said anybody presenting with symptoms of this nature these days, we are labeling them as COVID-19 positive. You have no access to the test, but we will treat it like that. And so I realized then my management was correct. We are going to treat it like COVID-19, no access to test. So I made this little tray, and if you notice, I'm going to briefly tell you what my experiences with holistic medicine are. And if you notice over there, you see the supplements. There is Immune and Laminin right there, which I was giving to them. I was using Immune. The dose was bigger than I normally give. So it's 2 every day with the meal. And I gave Laminin. I gave 2 every day, and I gave them with a meal. And I knew that vitamin C is important. So what I did is every day I would give them fresh fruit, whether it's oranges, whether it's lemons, and I gave them a lot of fruits. And another thing that we practice in Ayurvedic medicine, which I want to share with you, is during any viral infections, we always know that it starts from this region. So what is happening is the virus is still here if you get sinusitis, headache, and cough. Later on, when the cough becomes with more mucus, or you start feeling a lot of congestion, that's when the lungs are also affected, whether it's upper or lower respiratory infection. So I can still try to correct things and try to kill this virus, and it does show effects from heat and steaming. So doing gargles, I remember salt water gargles, using turmeric. Turmeric is an herb which is a part of the South Asian, household. I put it in everything I cook. It's part of my spices that I use for my daily cooking. But in the West, I realize they don't have the use of turmeric. Turmeric, it has curcumin in it. And curcumin is the active agent that we require to be absorbed in our body, right? For us to increase our immune system. It is anti-inflammatory. It also is an antioxidant. So I started using a nice special tea which I made, in which I boiled water. I put some ginger, a piece of ginger, 2 cups of water, an inch big size of ginger, cut it up into pieces, and I would put a little cinnamon in it, some black pepper, because guess what? Research has shown that when you use curcumin or turmeric, a pinch of turmeric, with some black pepper, it will get absorbed better. So this was my specialty. I would boil it. The 2 cups would become 1, and then I would allow it to cool a little, and then add 1 spoon of honey, which also has a lot of benefit to us as antioxidants, anti-inflammatory, vitamin C. Gatorade was there off and on to give electrolytes to the person. And then if you see a medley of these teas, which I can get in the US, but many people, they didn't know about it. So I would give them my recipe of a nice healing tea. We have a special herbal product in Pakistan called Jushanda, which has eucalyptus, licorice. Licorice is amazing if you can get it. So it heals the throat. But one treatment that really helped my clients and patients and my relatives is steaming. So I boiled water in a big pot. And then once it's nice and boiling, come and put it under, on the floor. And now let the person sit, and that pot is on the floor. You take a white sheet or any sheet, you just cover it, your bed sheet, all the way, and make a tent. So it's a tent, so the steam doesn't escape, and the person can just lift the lid a little and then allow that steam to enter the, from the mouth and nose. Deep breaths from the mouth and nose, just kind of inhaling it all in. Some people put eucalyptus in the water, some people put neem leaves in the water, an antiseptic, menthol, and then it's amazing to do that. Then I also wanted to encourage good lung function, right? So the breath I told you, I was trying to teach them how to do that. I also did tapping, and you can do that with the person standing or lying. And we have it in it's physiotherapy, chest physiotherapy. You start tapping them from the top to the front. And why are we doing it? Both sides, because we want to displace the congestion and the secretions and get it all out when they cough. And that was so beneficial for them, in trying to get rid of the cough. We also try to focus on nutrition, and the value of nutrition here was that I would give them a high protein diet if they didn't have any renal problems. Of course, my 3 patients didn't. So I was giving them chicken soup. I was giving them a handful of nuts, because as you know, cashews, they have so much zinc in it, and it's so beneficial. Pistachios are good. So, just a fist of nuts to improve that, and seeds like flax seeds, sunflower seeds, so amazing to just put on their salad. And I encourage them to have fruits and vegetables. And I know Salman hates fruit. He doesn't eat it. He thinks it's going to make him fat. But I still insisted on having a bowl of fruit at about 4 p.m. every day, because my Ayurvedic and Unani training taught me that the fruit cannot be mixed with food. So there are only 2 times of having fruit when it doesn't mix or encroach on your lunch, dinner, and breakfast. And that is 10 a.m. in the morning or 4 p.m. in the evening. So I try to introduce that protocol to them, making sure they sleep on time. It is so important, because you must have seen that people who really had bad sleeping habits got COVID-19, because they literally, the immunity, like I told you, got depressed. So if you see in this slide, you see some kind of seeds there. And I don't know if you're aware of black seed, but in Pakistan and India, we use a lot of that. It's called kalonji. And I would take 6 of these seeds and to tell my nephew and niece and my husband to literally chew them and then follow it with some hot water. And at times we also used sumac, and it's right there, and it is from a plant, a flowering plant, and it is used as a nice vitamin C source. If you don't have that, I have another recipe for you. You can take any lemon or lime, and you take off the skin, you try to dry it, and once it gets dried, you put it in your grinder, you make a powder out of it, and you take a spoon of it in hot water and drink it as a tea. It has amazing benefits of giving you vitamin C. So, I gave them fish, I gave them, because they are not vegetarians, but many people on this webinar might be vegetarians. So you can have, the substitutes, and I'll tell you what they are for people who don't eat beef or who don't have lamb or chicken, which I feel for the meat eaters is important because it has zinc in it. And zinc, as you know, improves your immunity. It's an amazing, mineral which will enhance immune systems in a great way. Sometimes I would also give my patients lozenges. I had tons of those lozenges also with zinc and vitamin C. But the goal over here is for people who can eat meat. You do have the meat. It's a great source to give you that energy. But if you can't, then you can also eat beans, garbanzo beans, and any legumes are going to give you a lot of energy during the sickness. This is plant-based protein, so you can take it with the same benefit. So I hope this slide, is also beneficial to many who are on the webinar right now, and they can, share it with their family and friends who are right now requiring a supportive help. Because remember, your doctor, your primary physician is the most important to actually consult before anything. But what I told you, all the stuff you see on the tray is something I used, and it's in my experience. So I practice experiential medicine, and Ayurveda and Unani is all about that. And like I told you, proof is in the pudding. All my patients, all 3, Salman, Sana, and my niece and my nephew, are enjoying good health now. And thank God, I'm so grateful because I hear horror stories of people, young and old, who have lost their lives, and may God bless them. But I am so grateful to the higher power for giving me the opportunity to serve them and to bring them back to good health. Next slide. So we have a testimonial from Sana, which we are going to play right now about her experience with COVID-19.
Hi, my name is Sana Huck. I recently recovered from coronavirus. I live in Brooklyn, New York, where the pandemic was rapidly growing during March, which is around the time I got sick. And I got sick because all three of my roommates ended up catching the virus from a friend of a friend of a friend, which tells you just how easy it is to end up, catching it. And that's despite all of us working from home, taking every precaution, keeping a 6-foot distance, cleaning everything regularly with Clorox. Despite our efforts, all four of us ended up catching the virus. And the reason we knew it was the virus was, despite not being allowed to get ourselves tested at hospitals, we all caught the symptoms very slowly, which is a major sign that it's not the flu, which, the symptoms for the flu are immediate. And our symptoms were also completely in line with what coronavirus is, such as having a fever, a bad cough, body aches, chest pain, difficulty breathing, losing your sense of taste, losing your sense of smell, stomach issues, everything, you name it, we had it. And a major one was body weakness, which after 2 weeks of having the virus, it took me 2 more weeks to recover. And a big part of the reason I was able to recover was because I was recommended the supplements Laminine and Immune, which are more holistic ways of being able to take your multivitamins. I did not know about them until I caught the virus, and I spoke with some people, asked them what they would recommend. My aunt recommended Laminine and Immune, and I started taking them from day one, and I found ever since then, it's been about a month since I recovered, and despite however hard it was to recover, I found Laminine and Immune were incredibly helpful in getting me to that point and helping me regain my energy, build my strength, in feeling completely balanced and myself again, which was very hard to do after dealing with coronavirus. It's not an easy, it's not an easy sickness to get through. I would like to say to anyone who is, suffering or well, old or young, whoever you are, whatever your condition is, I would honestly recommend Laminine and Immune as part of your daily intake, a part of your daily supplemental intake. They are very, very good at helping you regain any strength, at helping you just be yourself again, which is, exactly what we're looking for.
So that was Sana with her story, and she's up and about now, and I'm so grateful that all this is over and behind us. But still, being mindful, since viruses are not going to stop arriving in this environment of ours, and they are talking about a second wave, and then they talk about what will happen when flu season starts, since we don't have a vaccine till next year, and the corona will still be there. What will be the impact of two things together, the flu and then this particular virus strain? How are we going to stay healthy? How will we protect ourselves? So, my final words on this are that, remember how I started the presentation with the word balance? And this is a beautiful slide. And if you see this slide, it tells you how it's such a precarious system of balance, right, within our body also. If I remove one of these stones that you see in this slide, in this picture, everything crumbles, right? So that's how sensitive our systems are. But if you keep a balance in your life, in everything you do, mind, body, and spirit, you have better, tools, or better a sense of taking care of yourself. And I know there are many points I, kind of spoke about, which you saw in the slides, whether it was getting rid of the stress or, trying to exercise and everything. There are tons of things you can do, but the most important thing is listening to your body and trying to find that equilibrium which is yours. Everybody has their own unique equilibrium, and the job is to find out what your equilibrium is, because one man's food is another person's poison. We are all uniquely different. That's why, if you remember in the beginning, I had mentioned about the importance of having an integrative system where we have the ability to use modern medicine alongside many other alternative medicine, modalities like Chinese traditional, Ayurveda, Unani, Siddhi, and all of them giving us wonderful approaches to healing, which are better, good for us, and they are all working as healers to make us feel better. So that would be the future of medicine. That's how I see it. And before I complete my presentation and invite the scientist Kimberly to come and talk a little about her presentation on Revive, I would like to actually just leave you with some important things that you can also remember. So I want to talk about 5 things, okay, not too many, that you are going to be mindful of, which are important, and I call them primary foods. So my primary foods are not carbohydrates, fats, proteins, and vitamins or all that stuff. That's not my primary. That's not what I'm talking about here. My primary foods are, number 1, your nutrition. That is there. But I mean, it's something that you do anyways. The focus is on extra things which you need to incorporate with this. Okay, so nutrition, we are putting it on the side. You already know I talked about it. So the second thing is exercise. The third thing is your career. Okay, that's so important, to be happy. Are you happy? That's a question you want to ask yourself. Please do ask that. If you're not happy, there is something wrong. You need to correct that. And then the fourth is your relationships, right? Do you have solid relationships in your life? I think this was a good time to find out. Many people have lost jobs. They don't know the uncertainty of it all. What will happen to me? How will I pay my mortgage? So having a support system, whether it's your family members or it's some special friend in your life, or your sister or your brother, your mom, trying to work on that integral element, relationships, right? Because I found out, and research is showing that since COVID-19, because people were spending more time with their spouses and their kids, it's actually had some adverse effects also. The divorce rate has increased. Those are the stats that I read. So don't allow that to happen. I know your kids are home. They're not in school, and they might not go to school in the US, at least here in New York, we know till fall. So they are spending more time with us now. They used to go to school and spend maybe 3-4 hours at home, but now they are here with us. And I know it can get challenging, but trying to find good ways of enjoying those nourishing relationships, giving each other time. And even, I think I'm spending more time with my boys now. All of a sudden, I feel that they are home more, and we get to connect, we get to talk about topics and issues. So having that good thing happening. I remember one of my teachers, Dr. Mishio Kushi, who's the father of macrobiotic medicine, he said once to us during our talk that, do you know why the divorce rate in America is so high? And we said, no, we don't know. And he said, well, it's simple. There was a time when people ate together and the whole family ate food together from one particular kind of, even one, literally one source, right? But he said, now what's happening is wife goes to work, comes back, brings KFC chicken, and then the husband comes back home from work and he brings home a burger from McDonald's. And he said, the problem is that the cow cannot sleep with the chicken. So that, in other words, means when you and I have a different biochemistry, and food goes inside our body and becomes us, the different biochemistry can cause a clash, and the harmony goes away. So try to eat together, have a meal together every day, right? And then my final out of the 5 is spirituality. So, do you have a practice? Spirituality is not religion, it comes from love. Do you have a daily practice that you bring to yourself, whether it's yoga, whether it's meditation, whether it's just breathing? Or taking a walk out, mindfulness, any kind of practice which connects you to your soul, a space where you're never rejected, which is full of love. Love for you, love for the higher power who created you, and love for each other, love for humanity. That's what we need to practice. And right now, COVID 19 has put us in a position where that is being tested. We must exercise love for each other. We must not have a bias, whether it's a different gender or a race or a color. We need to get rid of all these things and come together as a community and exercise that beautiful science of balance and exercise empathy and love for each other. So, as my final word to you, at the end of this presentation, I am right now through this webinar, which is organized by LifePharm, sending you healing energy and all my love to all the participants, all the people who joined us on this webinar. May God keep you safe. May God keep you healthy. And the most important thing, may you stay happy. Thank you.
Thank you so very much, Dr. Samina. I'm back on with my video just to so that you can see me and just the energy and the pouring of course, of knowledge and love and really the healing and the hope. I think when I mentioned the beginning, when we started this webinar, this is a very special, unique webinar. It's not like any other monthly product webinars that we've had here and hosted here. The opportunity that you all get to spend and be able to have Dr. Samina's personal and professional experiences and her wisdom to be poured onto all of us. So I receive it from you as well. We're gonna now open this up and I'm gonna bring Kimberly back on so she can be on video as well. And we're gonna do something very unique too, is we're gonna move right into our live questions and answers because we did get many love being shared back in our chat room, Dr. Samina. And
Thank you.
there's many that are asking. So we're just going to do a few questions and answers with Kimberly here too. In the meantime, the love being sent to you from all of our IBOs, they're saying that they love you. They appreciate Kimberly. They think that this information is so powerful, as well as the video testimonial of your niece, which is incredible that we're talking about what we're all facing every day. And I think I took so much on notes. I just like I have a 2-page full of something that I've already received from you, but yet I am just words are standing out to me, about the 5 focus on everything in our life and what we need to do. And I am just so grateful. And I just want you to know, from the bottom of my heart and my spirit and my mind that you've really given me more hope in knowing that we do need to love ourselves. We need to take care of ourselves, but in the community that we live in, which is the global community of what our company is in over 45 countries, that we are the stewardship of each other. We need to take care of each other. So Kimberly, if you are on, can you please say hello as well, because I want to put questions on to all of you so that you have the opportunity, Dr. Samina and Kimberly, to answer.
Oh, hello. Thank you, Dr. Samina, so much. And Martha, your comments were just beautiful. We all just relished in all your good information and hope. And thank you so much for being with us today. We can move to the other things.
So the questions and answers right now, I have one that's from Jamaica, and it could be answered by you, Dr. Samina, or from Kimberly, whichever of the two. So how do we approach someone, friends, family, when it's about our products, like when they are facing cancer, when they're facing things that are, we want to be compliant. So we are not the experts, but yet you are, Dr. Samina. So even when you are talking about our products, what is the best way to introduce others to our products when they're facing truly dire medical conditions that we're not experts to speak about?
I totally get that question, but since I've been doing so much of the talk, I think I would like Kimberly, who has immense knowledge on the science of the products, to possibly start the answer, and then I will also give my thoughts on it. So, Kimberly, if you could answer that.
Here I am. We do have to be careful. In the United States, we fall under the Dietary Supplement Health and Education Act of 1994, so that the business community could start to create and make dietary supplements. So we do have to be careful, especially when talking about diseases, because the way the laws are written, only the drugs can fix diseases, mitigate, stop, prevent. So of course there's some gray areas, and we've done so much more research than 30 years ago in the benefit of certain nutritional supplements and how powerful they are. And the Ayurvedic and Indian studies, the studies in China with a lot of their herbs. So we're gaining and gaining information in these areas. So, and I'm not a physician. I'm more of a biochemist. I understand the chemistry of things. So that keeps me using those terms to say, well, it might help this organ or it might help that tissue. And of course, if you watch some of our other webinars, we have a little better way to explain, say, how the fibroblastic growth factor from the fertilized egg can support tissues and stem cells in various tissues. And that's what Dr. Samina was saying. There's a variety of things that might respond. So you give your input.
Yes. So the all the IBOs who are on the chat, and that LifePharm is right now producing glaminine, immune, digestive, and also you have the Revive, and you have for the skin. So there are medley of these products. Now, when a patient or a client, in your case, it's not a patient, it's a client, wants to get convinced, I think the most important thing always is the research. But my personal advice is usually to my clients is, of course, I tell them you need to eat good, nutritious food, which is organic and coming from a good source. But I try to explain to them that a lot of times it's not possible for us to eat 5 to 7 servings or 5 to 7 servings of any vegetable or any fruit, and you want to get it from a good source. That's important too. So what is happening in our life, like I talked about the humanity and the consciousness and all that, what has happened is that the greed in us humans has actually destroyed the infrastructure of how agricultural goods were supposed to be handled. The way a food comes to me and I put it in my mouth, the whole thing starts with the intention of the farmer who has a seed and he's going to plant it with good intention in the right soil, not keep using the same soil and deplete it of the minerals. And also the unfortunate thing is with the preservatives and the lack of good transportation, the food doesn't arrive on your plate in the way it was supposed to be. And so the nutrients that you're supposed to get are diminished. They're not there. So I see a lot of patients who have micronutrient deficiencies, which can be cured. And I know they have certain diseases which are happening because of it. So then I try to supplement. I do it only because I know that their food is not really taking care of that basic thing. And why LifePharm products? Because I know that the family does believe in, getting the product from the right. The ingredients are from the right source. They are holistic and they are credible people. The whole family is great. And Mr. Sayanto, I think he practices good business sort of ethics. That is so important. When I get a product that I'm going to use and put in my body, I better know the source of it. And I think with LifePharm products, I know that he has that compassion and that empathy linked to also, of course, doing business with this whole thing. And he is exercising that. And then, of course, for me personally, the proof is in the pudding. And you, again, also, I think, try to show the client's testimonials of people who have benefited, but do not try to give advice on prescriptions in patients who have cancer or who have certain diseases which are medical, because you do not have that expertise. It's important not to go there. But we know that this particular product that LifePharm makes, all the supplements have no side effects. We have not seen any drug interactions, and people have taken them with their medicines and had no side effects at all. So there's that safety, that also goes with these products.
Okay, great. Dr. Samina, thank you, and Kimberly as well. We have one more request here that's coming in live. First, I'm going to just read some of the comments being shared. We just love Dr. Samina and grateful for all her knowledge. Dr. Samina, they love your tray that you shared, your rescue tray. So how can they get some of that laminine, and how would you recommend something for the digestive system? And is that something that you want to answer live, or do you want us to send that through an email chat? So it's up to the both of you, Kimberly and Dr. Samina.
Well, personally, I think I would like to mention one of the products that LifePharm makes, which has really benefited 2 or 3 people in my life who were suffering from really weak digestive systems, and that is your product called Digestive. And I did some research on that, and Kimberly was kind enough to share some of her knowledge with me, which then convinced me, because I tried to, I have a 360-degree approach now. I studied modern medicine, and then I also studied holistic health or natural medicine. So putting them together gives me a beautiful perspective, a 360 perspective on health and well-being. And Kimberly then mentioned to me how digestive has prebiotics, probiotics, and it also has digestive enzymes. You see, so when a product is got why digestive enzymes? Because as we age, we do have a source of enzymes in our body, which are part of us when we are born, but slowly and gradually they start diminishing and they're unable to keep up with the demand. So if you had a supplement which is going to aid in the digestion of proteins, carbohydrates, and fats, that by itself is amazing. But talking about the probiotics, which I know many people are taking these days, we go and we see them on the shelves of so many supermarkets or pharmacies. Now, probiotic, the concept of a probiotic is that it is going to nourish my good bacteria which are in the gut, and it is going to improve my gut health. Unfortunately, many products in the market, what is happening is that they have probiotics which are going into my body, and when they reach the system, the acid destroys them, or they open up sooner than they should. But that is not right, because the objective of that particular capsule that you ingested was not to open it to release that good bacteria into the stomach where the acid will destroy. The purpose was to take it all the way to my large intestines with my gut microbiome is, and I want to deposit this good bacteria right there where it can be beneficial. So I saw that in this product Digestive, and I felt that the response I got from my personal patients has been that they are really feeling better, and they do not have bouts of diarrhea or constipation and all that happening. They are able to digest their food in a better way.
Wonderful. Another question's coming in is, oh, unless Kimberly, did you want to answer that question as well? I'm sorry.
Very good. Thank you.
Okay.
And Martha, I want to add one more thing. You've been seeing me sipping, so I want to show you this one little thing, which is unbelievable. So you just saw me sipping, right? So sipping warm water every day in small doses, just hot water, sipping it, but the temperature should be such that it doesn't burn you. So we are sipping hot water throughout the day, either with ginger or with nothing, just simple hot water is so amazing. Think of your digestive system as your plumbing mechanism, or your pipes. There's a lot of deposit of fat and of toxins, which we called ama in Sanskrit. it's when you drink this hot warm water, it literally cleans all your pipes and makes it nice and clean. So what I do is in the morning when I get up, I drink 2 glasses, 6-ounce glasses of warm water every morning before I do anything, before I eat. So it's like a nice flush. Like, you put it on in your sink when your pipes get clogged. So you just do that. And warm water goes in. And for people who are worried about their weight and of becoming, getting more calories or getting fat or whatever, I also tell them put a little lemon or lime in it. And then that's also going to help in getting rid of extra fat, which might be stuck there. So yeah, those are things. Tips for good digestive system are also to eat on time. And in Ayurvedic medicine, we say your heaviest meal in a day should be 12 noon. Why? Because your natural digestive fire is the strongest at 12. So you want your food to get digested completely and not leave stuff behind, because then it will not benefit you, right? So you need to eat when you're hungry. That's very important. You need to eat food only when you're hungry. So if you wake up in the morning and you don't have a desire to eat, don't eat. Just sip hot water till you feel hungry. And then not really filling it up till here, you want to leave a little space. Okay, so trying to stop not overburdening your system or satiety center, and then trying to eat on time. Like I said, the dinner should be early, and I like to eat 6:37, which is a great time, because it takes 3 hours for food to get digested. Now, if you ate at 9 till 12 p.m., you are not even, like, you literally till midnight, you guys have not digested your food. That is terrible, right? From 9 to 12, or maybe even more for people who have a sluggish digestive system. So try to eat more vegetables, healthier things, fresh food. Another thing I want to talk about is, please don't eat flunk foods. And you're going to ask me, what is that? So let's look at the acronym. Flunk foods. FLUNC. F is frozen. L is leftovers. According to Eastern science, food only stays fresh for 24 hours. Beyond that, it has no live energy in it, which means it is not giving you any benefit. Like I had mentioned, we need live energy, and that is gone. So even if you were to prepare something quickly, in the nick of time, because you didn't have time to cook, I would rather you had a piece of fruit. At least it was fresh and it had live energy in it, right? So the frozen, the leftovers, and then you have which is undercooked food. A lot of people don't cook food properly, especially meat products. If they're not cooked properly or they are raw, they can also cause problems and cause toxicity. And then nuked food, of course, we all know microwave is not a great option. We only do it once in a while. We don't want that to become something which is part of our life, because the food gets nuked. N is for nuked, which means the biology of the food or microbiology, chemistry, everything gets destroyed when you put it in the microwave, and can have a different effect on you. And then the C is for canned foods. So always focusing more on foods which are available. And remember another thing which we face in North America. Come on, nobody eats watermelon in winter. How many people are eating watermelon in winter? Because the supermarkets give you all foods all the time, all fruits all the time. Bad principle of nutrition. We need to eat seasonal. Please eat according to the season. And I also, since I consult on, people on their health, so I have a system of telling them what their mind-body constitution is, which I, as part of my allopathic, Ayurvedic training. So the history is all about what are you made up of? You are unique, right? What elements make you? my elements are different from Kimberly's elements. You know, they are all five. Of course, we have five elements like air, space, earth, water, and fire. But some people have more of some of these elements, which changes their mind body constitution. So we need to know who we are dealing with. What is your mind body constitution? Once I find that out, I will give you the kind of food you need, what to eat, when to eat, where to eat, all that stuff.
Thank you so much, Dr. Samina. What we are going to want to just do is to close this up with saying, reading a few more, just to give some shout outs to our webinar attendees that have stayed with us through all this. Dr. Samina, here's from Galena, you're amazing. Another person saying, thank you for your help. Abrin, I'm sorry if I'm not saying your name correctly. Thank you to Aaliyah Armando. Aisha, I believe, Batak, Dawn, Felicia, Galena again, Ida, Enisa, Irene, Luba, Miss Joan, Julia.
Oh, nice.
I love to give them shout outs because we just love our audience and the engagement of Abrin Nagani, sorry, thank you. Linton, Chris, Lavina, Lisa, Marina, I already shared, MJ, Nozat, Olga, and another Olga, Patricia, Reza, Tanya, Ven, and of course, Kimberly. You know, we want to thank everyone too. And so here's what we want you to be able to see, this beautiful picture of our powerhouse of health, beauty, and wellness, our products line right here. Next month, this month, we still have our Better Together, which is something that we want you to know is that our all one box of our 2-laminine, our immune, plus our digestive, as well as our omega-3 plus, all in one sachet. It's a 30-day system for you that you get to have this. Again, what we are offering, when you order your E5, you get to choose either our Lamiderm serum or our Omnia bottle, which is our skincare supplements. Next month, you'll get to hear from, again, Kimberly, where she's going to educate you, continuing to educate you on our products. I want you to know, just be mindful that this promotion is just for our North America, US, Canada, Jamaica, Trinidad and Tobago, as well as to our Oceania customers and IBOs for Australia and New Zealand. And one thing is, we also want to recognize and celebrate LifePharm, the birth, the beginning of LifePharm, and where we're at. We're young, yet we are strong, we are growing, we're thriving, just like what not only Kimberly, but Dr. Samina has shared from the very beginning, that our mission is to have everyone achieve optimal health, that body balance, that mind balance, the holistic approach. So we're so grateful for all your knowledge and what you've poured to our audience and to us as one family. So let's all together celebrate and be grateful that LifePharm, Laminine, and all of our DNA nutritional supplements are in our life. And for our customers, our retail, for all this promotion here is for free shipping to celebrate 9 days for 9 years with LifePharm. And it is for US only. So please take a picture of that. If you have not seen it before, we want you to take advantage of this. It does end this coming Monday. And most importantly, as I mentioned, this is a unique webinar because we were able to get this time with Dr. Samina. She is a very busy woman with being a business manager to her husband, who is really like this rock star there, and not only in New York, New Jersey, they travel all over the world, okay? Pakistan, they go to India, they go to very impoverished towns and villages, and I just love their heart and their soul and what they pour into the global wellness. So if you want more information from her, you want more one-on-one, which we did have someone asking to get more materials, research. This is how you can reach out, is research@lifefarm.com. Kimberly, as well as Dr. Samina, they are here to support you on your endeavors to be not only the best version of yourself, but then to be able to give to others and help them to believe that they can become the best versions of themselves as well. Would you agree with me on that, Dr. Samina and Kimberly?
Definitely, definitely. I think Kimberly's support with the science And then, my personal experiences with medicine are definitely a great combination with a platform provided by a company which is so, sound. I think it's a great team to actually take care of our health.
Well, and with that said, we want to see you guys and thank you so much, everyone, for tuning in. Again, I'm just going to read off just some more thank yous and gratitudes because I think this is a great way for us to sign off together. From another IBO, thank you so much for a beautiful, informative presentation. Miss Irene, thank you so much, dear Samina. Lavina, thank you, Dr. Samina, very informative. Thank you, Kimberly, as well, for all your support. We have IBOs from Jamaica and Trinidad saying the same thing there, Dr. Samina and Kimberly. And, when we say, we are in this together, we are stronger because of it. We are more able to serve each other. And so, with the way that you ended this webinar or your portion of it too, I just want to send the same love to be able to send out to everyone the blessings of healing, of love, of light. Stay healthy. Stay safe, and always know that we are here together as one family. So good day, everyone. Good night, good morning, wherever you're at. We love you, and we just can't wait to just continue to celebrate life because this is what it's all about. Life is precious. So good day, goodbye.
Thank you, everyone who joined. Thank you.
Thank you, Dr. Samina. Bye-bye, Kimberly. Bye, everyone else.